Day-to-day activities can often cause tight back muscles. Over time, this can result in significant back pain and increase your risk of a back injury. Learn some exercises to stretch all of the major muscles of your back in a quick and effective way. Performing these stretches will help prevent back pain and assist in reducing present back aches. Before starting any new stretching or exercise regimen, be sure to consult with your doctor. My name is Richard, and I want to welcome you to our channel, The Daily Health and Weight Loss. We want to say thank you very much if you have been watching our videos. But if this is your first time watching our video, please subscribe to our channel and hit the notification button so that you won't miss important videos. Let us discuss a few steps to keep in mind before you get started. Aim to hold each stretch for at least 10 seconds and preferably 30 seconds or longer. The pain relieving benefits will increase the longer you hold these stretches. Rather than rush through the moves, turn on soothing music and use this stretching time as a chance to relax and renew. Don't forget to breathe. It may sound silly, but focusing on using your breath can help you cope with any feelings of discomfort. Benefits of stretching include reducing tension in muscles supporting the spine. Tension in these muscles can worsen pain from any number of back pain conditions, improving range of motion and overall mobility, reducing risk of disability caused by back pain. Pain that lasts longer than 3 months may require weeks or months of regular stretching to successfully reduce pain. Stretches may be included as part of a physical therapy program and/or recommended to be done at home on a daily basis. Let us discuss the types of stretches. Child's pose. This traditional yoga pose works your gluteus maximus, hamstrings, and spinal extensors. It helps to relieve pain and tension all along your spine, neck, and shoulders. Its relaxing effect on your body also helps to loosen up tight lower back muscles, promoting flexibility and blood circulation along the spine. To do child's pose, follow these steps. With your hands and knees on the ground, sink back through your hips to rest them on your heels. Hang at your hips as you fold forward, walking your hands out in front of you. Rest your belly on your thighs. Extend your arms in front of or alongside your body with your palms facing up. Focus on breathing deeply and relaxing any areas of tension or tightness. Hold this pose for up to 1 minute. You can do this pose several times during your stretching routine. Feel free to do it in between each stretch. Cat-cow stretch. This dynamic movement moves the low back muscles in two directions and builds on child's pose to help lengthen contracted muscles and soothe soreness. Let us discuss how to do a cat-cow stretch. Begin in a tabletop position on your hands and knees, with your hands directly under your shoulders and knees under your hips. Your spine should be parallel to the ground in this position. Then round your back, stretching your mid-back between your shoulder blades, similar to how a cat stretches by rounding its back. Hold for 5 seconds, then relax and let your stomach fall downwards as you gently arch your lower back and hold here for another 5 seconds. Repeat these movements for 30 seconds or longer. Single knee to chest. Hip tightness is a frequent contributor to lower back pain. In order to stretch the hamstrings, lower back, and glutes, lie on your back with one knee bent and one leg straight. Place hands behind the leg and pull back towards your chest until a light stretch is felt down the back of the leg. You can also place hands over the bent leg on the shin or knee and pull towards your chest. Hold for 30 to 60 seconds, switch legs and do the same thing. Repeat 3 to 5 times for each leg. Please tell me how often you stretch your back on the comment section, and if you have not tried any back stretching exercise, please tell us in the comment section. Please like and share this video so that others can benefit from the knowledge. Piriformis stretch. This stretch works your piriformis muscles, which is found deep in your buttocks. Stretching this muscle relieves pain and tightness in your buttocks and lower back. To do a piriformis stretch, follow these steps. Lie on your back with both knees bent and your feet flat on the floor. Place your right ankle at the base of your left thigh. Then place your hands behind your left thigh and pull up towards your chest until you feel a stretch. Hold this position for 1 to 3 minutes. Then do the opposite side. Lack of core control and stability is a key player in lower back pain. When the abdominal muscles are not performing, the muscles of the lumbar spine have to work harder to stabilize the body in balance. An excellent way to improve core stability is to lie flat with the knees bent up. Tightening abdominal muscles as if bracing for a punch to the stomach and press the small of the back into the floor. Hold this contraction for 10 seconds and repeat 10 to 20 times. While lower back pain is extremely common, it is not something you have to live with every day. Improving hip flexibility and core stability, as well as lengthening the back muscles by stretching, can help reduce the symptoms of lower back pain. However, if your back pain is chronic, the above stretches may help, but additional treatment may be warranted. Supine twist. This stretch not only helps to stretch your lower back, but also your glutes, which can tighten when you are experiencing low back pain, ultimately causing more pain. Let us discuss how to do a supine twist. Begin by lying on your back with your knees bent and feet flat on the floor. Extend your arms out to the side in a T position. Keep your shoulders on the ground as you gently roll both knees to one side. Stay here 20 to 30 seconds, then return your knees to the center and repeat on the other side. If the stretch is too much for you, place a pillow or stack of blankets under your knees when you twist to each side. Important reminder: be sure to talk to your doctor before starting any new exercise or stretching program to make sure there are no restrictions in the type of stretching you should do. This is especially true if you have recently had spine surgery. Also, let your doctor know if you are experiencing pain when stretching. It may be an indication that your technique is incorrect or that you have an injury or some other medical problem. Over time, when done correctly, back pain exercise and stretch can help reduce your back pain. Thank you for watching our video on back stretches. I hope you learned a lot. If this is your first time watching our video, please subscribe to our channel and watch the other videos on your playlist.